Recent research from leading medical universities reveals a terrifying truth: the moment you turn 40, your brain begins shrinking by 0.5% every single year. But here's what shocked researchers even more. When they compared the brains of 40-year-olds who regularly lifted weights versus those who didn't, they found a staggering difference equivalent to more than 10 years of brain aging. If you're sitting at a desk right now or lying on your couch, your brain cells might be quietly disappearing as we speak. By the end of this video, you'll understand why strength training after 40 isn't just about looking good, it's literally about brain survival. You'll discover how to not only stop brain aging but actually reverse it. The terrifying changes happening in your 40s brain. Large-scale clinical studies by world-class medical research teams show that the changes occurring in your brain after 40 are far more serious than most people realize. The hippocampus, your brain's memory center, starts shrinking by 1% annually. This means by age 65, you could lose 25% of your hippocampal volume. Even more alarming is what happens to your prefrontal cortex. This region controls judgment, planning, and focus. And after 40, the neural connections here rapidly weaken. International peer-reviewed studies have proven this isn't just normal aging. It's heavily influenced by lifestyle choices. The most critical factor is the decline of something called BDNF, brain-derived neurotrophic factor. This protein is essential for brain cell survival and growth, and it plummets after 40. But here's the game-changing news: strength training can dramatically boost BDNF production. The shocking brain mechanisms of strength training. According to research published in prestigious international medical journals, when you perform strength training, your muscles release special substances called myokines. These travel through your bloodstream to your brain and trigger miraculous changes. First, brain blood flow increases by up to 20% during strength training. This delivers more oxygen and nutrients directly to your brain cells, with particularly dramatic improvements in the hippocampus region, responsible for memory formation. Second, neuroplasticity improves by over 40%. Leading medical expert groups have shown that regular strength training enhances your brain's ability to form new neural connections and strengthen existing ones. This means dramatically improved learning and memory capabilities. Third, neuroinflammation decreases significantly. Chronic brain inflammation is a major cause of brain cell damage, but strength training reduces these inflammatory markers by an average of 30%. According to global medical research team meta-analyses spanning 12 weeks or more. Mind-blowing research results that prove everything. One of the most stunning studies came from Australia, involving participants aged 55 to 86. Those who performed strength training twice weekly for 6 months showed an average 18% improvement in cognitive function tests. Even more remarkable, 1 year after stopping exercise, they maintained a 13% cognitive improvement. Brain imaging studies provide even more compelling evidence. MRI scans revealed that middle-aged adults who strength trained actually increased their gray matter density. The hippocampus region showed 8% grayer volume compared to non-exercising groups. Comprehensive clinical research by renowned international medical institutions provided specific numbers that will shock you. Participants in their 40s who strength trained 3 times weekly for 45 minutes showed 25% improved working memory, 20% better attention span, and 22% enhanced executive function after just 12 weeks. These were statistically significant differences compared to sedentary control groups. Age-specific strength training strategies. Your early 40s should focus on building foundational strength. Compound movements like squats, deadlifts, and bench presses performed 3 times weekly for 8 to 12 repetitions across 3 sets provide optimal results. This period shows the greatest improvements in both muscle mass and brain blood flow. Late 40s require adding balance and coordination challenges. Single leg exercises and unstable surface training become crucial. These movements specifically activate the cerebellum and prefrontal cortex, maximizing cognitive benefits. After 50, high-intensity interval strength training becomes most effective. 30 seconds of high intensity followed by 90 seconds of rest, repeated multiple times. International sports medicine authorities have shown this approach can increase BDNF secretion by up to 300%. Brain health maximization principles. Progressive overload is essential. Your brain needs continuously increasing challenges to adapt and grow. Increase weights by 2 to 5% weekly or add 1 to 2 additional repetitions. This gradual progression continuously stimulates neuroplasticity. Exercise variety prevents adaptation plateaus. Changing routines every 4 to 6 weeks or adding new variations forces your brain to create new neural pathways continuously. Mindful concentration during exercise amplifies benefits. Focus on perfect form and controlled breathing rather than just moving weight. This conscious attention dramatically enhances prefrontal cortex activation. Lifestyle factors that multiply exercise benefits. Adequate sleep is non-negotiable. 7 to 8 hours of quality sleep after exercise allows optimal muscle recovery and brain neural restructuring. Without proper sleep, exercise benefits are severely compromised. Protein optimization requires 1.2 to 1.6 grams per kilogram of body weight daily. This supports both muscle recovery and neurotransmitter synthesis in your brain. Leucine-rich sources like chicken breast, eggs, and milk are particularly beneficial. Omega-3 fatty acids from salmon, mackerel, and tuna consumed 2 to 3 times weekly, or through supplementation, can enhance exercise brain benefits by 20 to 30%. Dangerous exercise mistakes and warning signs. Excessive high-intensity exercise can backfire by elevating cortisol, a stress hormone that damages brain cells. If you experience extreme fatigue or insomnia after workouts, reduce intensity immediately. Never exercise through pain. Training while injured activates stress responses that counteract brain health benefits. Persistent joint or muscle pain requires professional medical evaluation before continuing any exercise program. Stop immediately if you experience dizziness, severe shortness of breath, or chest pain during exercise. Seek medical attention right away. Those with family history of cardiovascular disease, diabetes, or hypertension should undergo health screening before starting any exercise program. Timeline for noticeable changes. Most people notice improved sleep quality within 2 to 3 weeks of starting strength training. Concentration improvements become apparent after 4 to 6 weeks, and actual memory enhancement is typically felt after 8 to 12 weeks. Check these self-assessment markers. Are you learning new information faster than before? Can you multitask more effectively? Are you experiencing fewer tip-of-the-tongue moments? Do you approach complex problems more logically? These improvements indicate your brain is literally getting younger. However, individual results vary based on existing health conditions and medications. So continuous monitoring and professional consultation when needed is recommended. The bottom line truth: strength training isn't just about building muscle after 40. It's about brain survival. The research is overwhelming and undeniable. Every day you delay starting is another day your brain cells are disappearing forever. The choice is yours, but the science is clear. If you want your brain to remain sharp and agile 10 years from now, strength training isn't optional, it's essential. Start today, because your future self will thank you. If this video opened your eyes to the connection between strength training and brain health, hit subscribe, like, and turn on notifications for more evidence-based health content. Your healthy aging journey starts with the information you act on today.